Bloodborne pathogens are disease-causing agents that are capable of being transmitted to individuals through exposure to blood or other body fluids. Some employees are often in situations where exposure to blood or other body fluids is a definite risk. In this module, you will understand bloodborne pathogens, discuss how bloodborne pathogens are transmitted, and consider some specific types of bloodborne pathogens, including the hepatitis B virus, or HBV, human immunodeficiency virus, or HIV, and hepatitis C virus, or HCV. These three viruses, among other infectious agents, may be present and can be transmitted through exposure to blood or other potentially infectious materials. We'll begin by talking about OSHA's bloodborne pathogen standard in more detail. The Department of Labor's Occupational Safety and Health Administration recognizes the need to protect workers from the health hazards of exposure to bloodborne pathogens that may be found in blood or in other potentially infectious materials. The bloodborne pathogen standard addresses the risks of exposure with a special focus on the hepatitis B virus, or HBV, and the human immunodeficiency virus, or HIV. But in fact, the OSHA standard is designed to protect employees from risks associated with exposure to any other bloodborne pathogens as well. For example, the hepatitis C virus, or HCV, also has been identified as another significant occupational risk, and there are many other pathogens capable of being transmitted by blood or other body fluids. The federal OSHA bloodborne pathogen standard is available at the OSHA website. Bloodborne pathogens are microorganisms that may be present in blood and other potentially infectious materials that are capable of causing disease in people. The pathogens that cause most diseases are bacteria and viruses, sometimes simply referred to as germs. In this training program, when we refer to blood, the term includes human blood components, and products and medications made from human blood. When we talk about other potentially infectious materials, we're referring to three categories. The first category is human body fluids and includes semen, vaginal secretions, cerebrospinal fluid surrounding the brain and spinal cord, synovial fluid surrounding the joints, pleural fluid surrounding the lungs, pericardial fluid surrounding the heart, peritoneal fluid surrounding the abdomen, amniotic fluid surrounding an unborn baby, saliva in dental procedures, any body fluid that is visibly contaminated with blood, and all body fluids in situations where it is difficult or impossible to differentiate between body fluids. The second category of potentially infectious materials includes any human unfixed tissue or organ. The third category includes HIV-containing cell or tissue cultures, organ cultures, and HIV or hepatitis B-containing culture medium or solutions, and blood, organs, or other tissues from experimental animals infected with HIV or hepatitis B. The concept of universal precautions may be summed up simply by stating, treat all blood and other potentially infectious materials as if they are infectious. This means wearing the right personal protective equipment and following basic safety practices in your workplace. Standard precautions is a higher level of precautions that was developed subsequent to universal precautions, and most healthcare facilities today choose to follow standard precautions. The primary features of standard precautions are hand hygiene, barrier protection by using such things as gloves and other items of personal protective equipment, safer needle practices, respiratory hygiene, and cough etiquette. How are bloodborne pathogens transmitted? Bloodborne pathogens such as bacteria and viruses can gain entry into the body through needle sticks or other sharp injuries, through breaks in the skin, or through contact with mucous membranes. Your skin usually forms a strong barrier against pathogens, but microorganisms can still enter your body through cuts, abrasions, open sores, blisters, significant burns, or through contact with any type of damaged or broken skin. If a person is splashed in the face by contaminated blood or other potentially infectious materials, pathogens can enter the body through mucous membranes in the eyes, nose, and mouth. These tissues are less resistant to pathogens than intact skin. Once inside the body, a pathogen generally travels to specific target organs. The hepatitis viruses, for example, invade liver cells. HIV viruses attach to certain immune system cells known as lymphocytes. Once a virus gains entry into the target cell, it begins to multiply. If it continues to increase unchecked by the immune system, it can cause disease. The organ targeted and damaged by the pathogen is typically the organ responsible for producing the signs and symptoms of the disease. Some pathogens also can be carried indefinitely in the body and passed on to other people. In the workplace, viruses and bacteria may spread from one human to another through exposure to infected blood or other potentially infectious materials, or from objects contaminated with blood or other potentially infectious materials. In your workplace, be aware of the most likely situations in which exposure to blood or other potentially infectious materials may occur. For example, it could be cleaning up the examination room after a patient visit, handling blood or tissue samples, or as the result of providing first aid. Infections can easily be spread through accidental punctures or cuts from contaminated needles and other sharps or broken glass. Hepatitis B is a common virus that may be effectively transmitted through exposure to blood or some body fluids from one infected individual to another. In the United States, 700,000 to 1.4 million persons are estimated to be infected with the virus, many of whom are unaware of their infection status. When hepatitis B enters the body, the liver is affected. Most individuals who develop acute hepatitis B remain infected for a short period of time and then develop sufficient antibodies to help clear the virus from their system. However, during that short period of time, their blood and body fluids are highly infectious. A small percentage of adult hepatitis B patients do not clear the virus and can remain infectious for life. These individuals may develop chronic hepatitis, often leading to scarring of the liver, which is called cirrhosis. It can also lead to liver cancer. In the workplace, hepatitis B can be spread through contact with blood, contaminated needles, and other sharps, syringes, saliva and dental procedures, and improper tattooing practices. It can also be spread by semen and vaginal secretions. The virus is not spread through food, water, casual contact, or coughing or sneezing. The symptoms of hepatitis B may include jaundice, a yellowing of the skin and eyes, loss of appetite, nausea, vomiting, fatigue, fever, and stomach or joint pain. A blood test will generally confirm whether or not a person is carrying this virus. Fortunately, a vaccine that is highly effective against hepatitis B is available. Osha specifically requires the employer to offer this vaccine to employees who have a potential exposure risk. We will discuss the vaccine in more detail later. The human immunodeficiency virus, or HIV, attacks the very immune system cells whose job it is to fight off infection. It specifically invades and destroys certain lymphocytes that normally resist infection. With the immune system cells impaired, the body's ability to withstand unusual infections is reduced. Cancers can also develop. This condition is called acquired immune deficiency syndrome, or AIDS. HIV may be spread through blood, body fluids containing blood, fluids surrounding the brain and spinal cord, fluids surrounding bone joints, and fluids surrounding an unborn baby. It also may be spread by semen and vaginal secretions. In the course of your work, you may come into contact with the blood or other potentially infectious materials of HIV patients. You should follow the strategies of universal precautions or standard precautions that call for treating all blood and other potentially infectious materials as if they are infectious. More than 1.2 million people in the United States are living with HIV. Almost 1 in 8 are unaware of their infection, and approximately 50,000 new HIV cases are reported each year. You cannot rely on symptoms to know whether or not someone is infected with HIV. The following warning signs, however, may indicate HIV infection: rapid weight loss, dry cough, recurring fever or profuse night sweats, severe unexplained fatigue, swollen lymph glands in the armpits, groin, or neck. Each of these symptoms, however, can also be related to other illnesses. Getting infected with HIV is really the first stage of AIDS infection. At this stage, a person may show few or no signs of illness for years. During the second stage, the lymph glands swell, often accompanied by other symptoms such as weakness, sore throat, loss of weight, fever, headaches, nausea, diarrhea, and a white coating on the tongue. During this stage, infections and cancers not commonly affecting healthy persons take advantage of the body's weakened immune system and begin to cause disease. There are more people living with AIDS in the United States than ever before because of effective treatments. These treatments may reduce the amount of HIV virus, help prevent infections, and allow patients to lead more normal lives. The only way to determine if someone is infected with HIV is to be tested. If you are tested, your medical records, including a diagnosis of HIV, are considered confidential, except as may be required by law. No employer has the right to this information. The third disease we're going to talk about is hepatitis C, or HCV. Hepatitis C is probably the most common viral infection spread by blood. Like hepatitis B, hepatitis C affects the liver. Approximately 3 million people in the United States have chronic HCV infection. Infection is most prevalent among those born during 1945 through 1965, the majority of whom were likely infected during the 70s and 80s. As a result, CDC recommends screening for HCV infection in this population. Unlike patients with hepatitis B, however, most hepatitis C patients do not clear the virus from the liver, and therefore they remain infectious. Approximately 75 to 85% of newly infected adults and adolescents develop chronic infection. These persons have some liver damage, but many do not feel sick from the disease. Some persons with hepatitis C may develop cirrhosis, scarring of the liver, or liver cancer. Hepatitis C is spread through contact with blood or other potentially infectious materials. Hepatitis C is less easily transmitted than hepatitis B. The hepatitis C virus is not spread through food, water, casual contact, or coughing or sneezing. Like hepatitis B, the symptoms of hepatitis C may include jaundice, a yellowing of the skin and eyes, loss of appetite, nausea, vomiting, fatigue, fever, and stomach or joint pain. The majority of persons with hepatitis C typically have no symptoms at all and don't know that they have viral hepatitis, yet they may be highly infectious. A blood test will generally confirm whether or not a person is carrying this virus. Unfortunately, there is no vaccine to prevent hepatitis C. However, drug treatments are available. Many people with hepatitis C may also be at risk for acquiring hepatitis B and should check with their physician to see if they should be vaccinated. You've now completed Module 2 and understand bloodborne pathogens, how they're transmitted, and learned about hepatitis B, HIV, and hepatitis C.